Hey, Andrew here, and here are my day 3 reflections from the Ottawa conference. Started off with a great presentation by Courtney and Kath from Flinders Uni that was talking about assessment within Aboriginal health. I thought there's some really good thoughts there just around Aboriginal health, education delivery, as well as assessment. I just want to put this fair test idea because I took a photo of that. They highlighted that there's a bunch of quite racist research that is still being cited around Indigenous health, which that is a problem in itself. Often there's this no room for Aboriginal education in the curriculum, that there's just so many other things it's not seen as essential and there's not room, or it's kind of tacked on later. Or they did a really clever thing where they put one of those magic eye pictures and said, looking for Aboriginal health education and assessment within a curriculum is like using the magic eye. You have to look like really closely, and after a while it just kind of pops out and you go, oh, there it is, and it shouldn't actually be that hard to find it. She contrasted Western versus Aboriginal systems of knowledge, and I thought that was really thought-provoking around the ideas of that. One of the contrasts that she drew was that Western knowledge is quite reductionist, whilst Aboriginal knowledge is more expansionist. Also talks about that there's always going to be quite significant bias and influences from the educator standpoint and their experiences and background personally and professionally with Aboriginal health. There's a slide on that which I'll just put up now. So lots of thought-provoking ideas there around probably not one solution, but a lot of things that we need to consider when we think about assessment within Aboriginal health. So thanks to both them. And one of my particular highlights of that whole session was a lot of roasting of my colleague and senior David Prideaux, who's well known within the education realm, and after whom the Prideaux Centre for Health Education in Flinders Uni is named after. Then there was a really good kind of panel discussion around cheating within university context. So the point was, it's happening, and it will happen more if an exam or assessment is high stakes. If it feels like other people are cheating as well, more people will cheat. If there's very low penalties for cheating, then people will cheat more. And if there's a low chance of being caught, people will cheat more. So if we can alter some of those things, we will naturally reduce it. And someone made the point, you can't prevent all cheating, you can just reduce the chance that people will cheat, and you can increase the chance that people will be caught. So a lot of discussion was around there about academic integrity. I've taken a picture of the slide that kind of defines what that looks like, because there's a lot of definitions. Essentially, there was like a lot of principles around that academic integrity, which are very related to health professions, of honesty, trust, fairness, responsibility, courage, and respect. They also talked about the idea of honour codes, which were used a long time ago. I think the first one was in the early 1800s. And there's actually evidence that shows that if you develop an honour code and get people to sign up to an honour code, that in itself will reduce the chance of people cheating. And it builds a positive culture of integrity by having those honour codes that if you introduce them earlier. Definitely cheating, it can be a very emotive issue, and students need support around it. I think it's very easy to come down hard, be very disciplinary, but making sure that people are emotionally supported and there's a psychologically safe place to talk about it and debrief it and help people consider what strategies they would use in future instead of cheating is really important. There's a whole lot of tech solutions that are available. I've got a slide that I'll just put up here that shows some of those things. Chris, who's a psychometrician in England and involved with the MRCP, which is the main written exam for physician trainees there was a leak, and he went through the way that they found and investigated that by using statistics to identify the likely people that were a part of the leak and then investigated and found that there was someone on the board of the committee of the MRCP who had leaked these to a preparation course, and how, although there was consequences for the person on that board, the fitness to practice and the GMC, which is our AMC equivalent, decided not to take any formal action regarding their registration, which was interesting. And then later, some really interesting things like the ethical use of artificial intelligence that came out of Qatar. So talking about, there's a guideline that they've produced and published for their students that are founded on the 3 kind of principles of accessibility, accountability, and integrity. And I think that's really important, that we need to be proactive with putting forward guidelines and understanding around how to use AI tools. They are and will be an increasing part of health professions. They are and will be an increasing part of health professions, education, and potentially assessment. And so we need to make sure our expectations are clear for our students and our educators and clinicians around how to use that in an ethical way and for the benefit of our staff, students, and ultimately patients. There was a really good example of artificial intelligence writing MCQs. It saves a lot of time. I would say that if you're using ChatGPT or some other similar kind of AI platform to write MCQs, it's definitely going to save you time. They always need editing, was the summary, so it can be a great first draft. The more specific prompts you can give around what you want, the higher quality and less editing will be required. And you can use the chatbot to actually edit it by saying, please remove these things, and it will learn from that. Giving it examples and specific prompts will produce high quality content as well. And the difficulty level is quite variable, and there is a heavy focus on fact recall if you use AI, the current AI tools available. So that's something just to bear in mind. And again, using more prompts might help move away from fact recall, which is, I'd say, was a bit of a theme of the conference, of that we need to move away from fact recall and more to application of reasoning and clinical wisdom, the combination of knowledge and other things. And you need to proofread everything. So summary was, AI can be very helpful at saving time and producing a variety of questions, but there still needs to be a very stringent editing process around that. And then I shifted over to some talks on residency. So the great one from the Royal Australasian College of Surgeons, talking about a external validated workplace-based assessment program that they've been piloting for specialist international medical graduates that are looking for surgical recognition in the Australian context. And they've done that for 9 candidates, and that seems to be a really good and valid and reliable method when you're using specially trained assessors that are coming externally to wherever the candidate is actually training, and that's much better potentially than getting them to sit the fellowship exam, which has a half the pass rate of local graduates. And then also some stuff around GP training in Canada, a presentation from an Anne Lee, who talked about the relationship and over time and the benefits and pitfalls that are there. Very interesting as well. And then had a guy, I think his name was Kevin Eva, who kind of summarized a lot of the themes of the conference, which was excellent as well. I wouldn't say there was any one thing I took away from that, but I did like that he touched on a series of different themes that were there. And just overall, good conference. So if you're interested in future, I would recommend Ottawa, especially if it's coming to near you. Check it out and consider what things you could present, because I'd say that there was some really great research and stuff presented, but the bar is not super high. And so if you've got something that's a little bit innovative and something that's interesting and you've done a bit of research around it, it's very possible for you to get in and do at least a short abstract or poster at this kind of level of international conference. So I hope that's interesting. See you soon.